Hi, everyone, and welcome. I'm Fritz Mayer, Dean of the Korbel School. I'm so glad you're with us today. Welcome to our conversation about COVID and democracy. No surprise to any of us, we're in the midst of the greatest pandemic of our lifetime. And of course, rightly, the focus has been on health and the economic impacts of the pandemic. But today we want to talk about the impacts on democracy and democratic institutions really around the world. Among its many features, this is apparently disruptive of our whole systems of government. I was reading an article the other day referencing the historian Barbara Tuchman, who wrote about the way in which the bubonic plague of the 14th century destabilized the whole old world order, in some ways paved the way for modernity, including modern forms of democracy. She wrote, if a disaster of such magnitude was perhaps not God's work at all, the absolutes of a fixed order were loosed from their moorings. Well, fortunately, this is not the bubonic plague, but the question is just how destabilizing is this? And today we have a chance to have a conversation, and I'm really excited about that, with three colleagues at the Korbel School. And let me introduce them each, and then we'll launch into our conversation. Professor Rachel Epstein, who is the Associate Dean for Faculty and Research here at the Korbel School. Professor Epstein's research and teaching focus on broad issues of international political economy and international security. She's a particular expert on developments in post-communist countries of Eastern Europe, including the impacts of European Union enlargement and expansion of NATO. She'll be bringing that expertise to the conversation today. Professor Sandy Johnson directs our Global Health Affairs program and teaches courses on health and international development. Her recent writing concerns the interaction of health and economic development, a topic we'll certainly touch on today, and the impact of conflict on human development. Not surprisingly, Sandy has been in huge demand recently. And last but certainly not least, Professor SINGUMBE MUYEBA, who focuses on economic development and poverty reduction, particularly primarily in Africa. His particular expertise is on the challenges of rapid urbanization, and urbanization and the pandemic are actually closely intertwined. Prior to joining the Korbel School, he worked for the UN Development Program and the UN High Commission for Refugees. So, welcome, colleagues. It's great to be with you today. What a great group to have this discussion. Before we jump in, let me a couple of housekeeping things. We'll have a conversation amongst the four of us for about 35 or 40 minutes. But we do want to save time for Q&A. You'll see that you have a button, I believe, at the bottom of your screen for Q&A. If you would type your questions, we'll be screening them. We'll try to get to as many of them as we can. So let's jump in. I'm going to start with Sandy. You know, there are all these articles now, including one I just referenced, reminding us that this isn't the first pandemic in history, although perhaps the biggest one of our lifetime. So people look back at of course, the 1918 flu, smallpox and other diseases that decimated the Americas all the way back to the Black Death. I'm just wondering if you could help us put this in historical perspective. Just how big is this and how long might it be with us?
So as you mentioned, this is something that we really haven't seen in more than 100 years. And I think what's challenging is this is a novel infection. It's spread through respiratory transmission. It's highly infective. To date, we have no pharmaceutical interventions. So even though it's the 21st century, it feels like we're back in the 1300s. And like when I think about infectious disease, I think about what model makes sense in terms of how this spread, in terms of the reproductive rate, in terms of the tools we have to combat it. And I think with that, it does most closely resemble influenza. But when I think about what type of social change are we seeing or might we expect to see, unfortunately, I think this is where bubonic plague comes in. And I love the quote that you had from the distant mirror. I think that that's I mean, it's a fascinating book. It's like 700 pages long. But the bubonic plague reconfigured the world order. And, you know, I hate to say it, but I think that we're seeing challenges to the world order right now with coronavirus. In terms, I think a lot of people have been saying, okay, this is like 1918, this is like 1918. So let's talk a little bit about how it's like 1918. It is like 1918 because we don't really know what we're dealing with. We're learning something every day. But I do just want to put it a little bit in perspective. The 1918 pandemic lasted anywhere from 18 to 24 months. And during that time, it's estimated that there were 500 million cases worldwide. Where we are right now with coronavirus, let's say it's been around since, we'll be generous, we'll say it really kind of started spreading in January. And so right now we have 4 million cases. In terms of global deaths, the 1918 pandemic caused anywhere from 20 to 50 million deaths, again, over the course of 18 to 24 months. Where we are right now with Corona, we have a large death toll. We have 283,000 roughly deaths. So we've lost more than 250,000 people, and really what we're seeing in 3 to 4 months of global spread. That's high, but if you think about this low range for 1918, if we're looking at 20 million deaths over 24 months, that's 830,000 people a month that are dying. We're not seeing that. Now, one thing to keep in mind, the 1918 pandemic started during World War I. And it spread around the world. It was killing young people. It was killing 20-year-olds and 30-year-olds. But people weren't living into their 70s at that point in time, and we had a world at war. So we had high levels of undernutrition. We had high levels of heavily concentrated populations. We had health systems that were pretty much all but destroyed. The world is different than that right now. While we've seen flaws in health systems around the world, and while we're seeing these kind of fault lines, particularly with vulnerable population, with congregated living, with poorer populations, with prisoners, with refugees, with minority groups, we don't have the same level of global vulnerability that we did in 1918. And so I hope I'm correct when I say this, we're not going to see that level of mortality.
Yeah. Yeah.
In terms of the social structures, I think you did a great job talking about it. You know, the bubonic plague, what was interesting about the bubonic plague, that killed anywhere from 20 to 50 million people. That had a huge death toll.
Incredible, yeah.
And that was over the course of 7 years, that was over the course of 7 years. And it was 75 to 200 million globally. I was looking at European numbers. And what we saw is initially we really did see a collapse of social order. We saw the rise of religious extremism. We saw fractious politics. We saw heavy death tolls, particularly in the urban areas. But out of that, we actually saw some positive change. Because of the death tolls in the urban areas, workers were actually able to negotiate for higher pay, and we started to see the collapse of the feudal system. We had restrictions on travel, and we saw kind of these major universities in Europe start to shut down because they weren't getting students. So that was bad. But the result was we started to see local communities invest in universities. So the longer term, there were these social changes, but...
Very interesting. Yeah. It's, well, that's extremely helpful. I mean, at some level, the good news is it doesn't look to be as bad as 1918. It's certainly not the bubonic plague. So from a health perspective, you know, it looks perhaps less dramatic, although we're in the midst of it. It's hard to have that kind of perspective, but that was very helpful. But let me segue though to Singumbe. And you study economic development and urbanization and poverty reduction. You know, in this crisis, of course, a health crisis, but it's also very much an economic crisis. You know, here in the U.S., of course, and what we know about it is that inevitably the most vulnerable here in the U.S. and around the world are probably most impacted by the economic collapse. And so I'm curious what you are seeing in the developing world and how that is. How the economic disruption may be also disrupting the politics in developing countries.
Yeah, Thank you very much for that question. Actually, this is really, really interesting. So I want to start off with just giving a bit of a context with regard to the African context. So there are about 1.25 billion people at the moment. 43% of Africans live in urban areas. And out of the 55 countries, 22 of them are predominantly urban and 33 are predominantly rural. With regard to COVID-19, what we're seeing is that currently there are about 70,000 confirmed cases and nearly 2,500 fatalities. The total number of cases are higher in urban areas than in rural areas. In terms of impact, the biggest impact is definitely economic. So, you may have heard the IMF say that this will probably cause a global recession, perhaps almost a depression. In the African context, the UNECA, that's United Nations Economic Community for Africa, and the World Bank predicted about 2 to 5% reduction in GDP growth rates. But the biggest impact is to the informal sector, because the entire continent has about 87% of people in the informal sector. That's if we include agriculture. If we exclude agriculture, we're talking about 70% of the population. And so this is the population that is highly impacted because immediately shutdowns and curfews were instituted. This population stopped earning.
Yes.
And in addition to that, most of the governments did not put in place any sort of safeguards for livelihoods. And so that is where the biggest impact is. This is why we saw that 2 weeks after implementation of shutdowns and curfews, we started seeing protests. So places like Malawi, Nigeria, South Africa as well. All of these protests were related to the economic impact. These are people that earn, that consume what they earn on a daily basis. Yeah. So that really led to a lot of protests. And after that, of course, the way that governments dealt with these protests were to, really be sort of draconian in certain cases. So in Nigeria, we saw about 18 people killed. And at that point, only 11 people had died from COVID. So there were more people that had died from these draconian measures. Governments used the military to address public health issues. So these are some of the impact.
Yeah, no, that's very helpful, and you can really see the ways in this, particularly in the informal sectors. You say that there's no margin there, and there's no safety net, and extremely vulnerable. And we'll come back to this theme about the kind of protests and the ways in which people are responding to it. But that's a great segue into the question for Rachel, really. So yes, health crisis. Yes, very much an economic crisis, but arguably also a crisis for democracy. So, this is in some ways the core question of our panel. So, in what sense is this a crisis for democracy? And what should we be looking at? How would we know that is in?
Thanks, Fritz. And Hello, everybody. I'm sorry that I can't see you, but it's very nice to be here. So I'm going to emphasize 4 elements of democratic governance that I think are especially important in this crisis. And I think it is a crisis, though we get to see how dramatic a crisis. I mean, the 4 areas that people who are concerned about democracy are looking at have to do with elections, first of all. Secondly, the ways in which checks and balances either do or do not hold up in democratic countries. And by that, I'm talking about how the executive's power is balanced and constrained by other institutions, including courts, parliaments, the media, also the opposition. That's a critical piece and one that we're seeing being deeply affected by the current crisis. Democratic watchers are also looking at the accountability of the leadership and how that's being affected by the crisis. And then fourthly, which we've all experienced, which is why we're sitting at home, the effects on rights protections of individuals, including, very importantly, and going to what Singumbe just said, the freedom of assembly and the freedom to protest. So with respect to whether we should be concerned, I mean, all of these areas of the quality of democratic governance have been curbed around the world, democratic countries, and then equivalent curbs also in more autocratic countries. So there is reason for concern, but I think in democratic countries we can be more nuanced in how hysterical we become about the changes that are taking place in terms of whether the measures that are being taken right now are temporary, whether they're proportionate, and whether they're necessary. Just to expand a little bit on the elections example. So as of last week, 58 of the world's elections across countries have been postponed. And on its face, that's potentially an alarming number of elections, which does represent a serious disruption to democratic process. And of course, on the issue of leadership accountability, you can't really hold leaders accountable if you're not having elections, right? So it's clearly a problem for the quality of democratic governance. On the other hand, in this pandemic, just moving blithely forward with elections can also be a democratic problem. And so you can draw a contrast between the experiences, let's say, of Wisconsin, South Korea, and Poland. And in 2 of those cases, there was an insistence that elections go forward. I would say in Wisconsin, that was a disenfranchising exercise, whereas in South Korea last month, it was completely the opposite experience. It was so well organized and executed. They actually had record high turnout, and they had systems by which even people who were sick and were, judged to be ill at the polling station had an opportunity to participate anyway, because they had a separate place to go for people who were testing positive for the virus. And so I think what we don't want to do in our assessment of the quality of democratic governance in the pandemic is to overgeneralize or reach hasty conclusions about democratic erosion, because a lot of democratic countries around the world are very sensitive to the kinds of concerns that I'm raising and, are being proportionate, are terming the restrictions, are looking at and weighing in their own political cultures what's really necessary. So there are deep problems, but I think the jury's still out on how enduring the restrictions that we're seeing will end up being.
Well, that's very helpful, Rachel. And of course, as you alluded to, the issues facing democracy are not, preceded the pandemic, to be sure. But that said, pandemics are kind of hard on democracies in a way. And so I wanted to explore with all of you really, the way in which the imperatives of public health do or do not kind of conflict with the imperatives of a democracy. So many of the measures that we need to take in the context of a pandemic, social distancing, tracking each other, centralizing information, these kind of control measures that we want to take are in some degree of tension anyway with the kinds of things that we like in a democracy: freedom of assembly, certain amount of privacy, and concern about centralized information and the like. And I'm just I'm just curious what your sense is of how we best go about balancing those imperatives. And any of you could take that. No, Sandy, you want to jump in on that? Yeah.
Well, I'll just start because Rachel, you made the point that what we should be looking at is, are the measures temporary, are they proportionate, and are they necessary? And if we start with kind of international law and the international health regulations, they allow for things like isolation, they allow for quarantine, they allow for tracking personal information, so long as there are certain preconditions in place. And those are the preconditions that you spoke about. When we go to the US, we have this under federal law, we also have it under state law, and one of the expectations is due process. Implicit in that is the idea of transparency. And I think that that's where we see some challenges with democratization, is the transparency of the information that's being used to make the decisions. And I mean, part of that, to me, a little bit of that is science literacy. When we do look at some of the democratic models that have responded relatively well to the coronavirus, you know, we'll look at Singapore, we can look at Taiwan, South Korea keeps being held up as an example. There is a high level of science literacy, and there is a great deal of transparency about information from day one. So there was trust in the government and the government's ability to contract and expand measures. Singumbe, I don't know, can you talk a little bit about that in the cases that you're following?
Oh, you're muted, Singumbe.
Thank you. Sorry about that. Yeah, in the cases I followed, what is happening is, so the public health measures are really being accepted, particularly if they do not go against economic livelihoods. But then it is the issue of how the governments treat those that are being quarantined. Mm-hmm. So I'll give an example. In Kenya, people were being quarantined. The standard was supposed to be 14 days, but people were staying longer than that. But in addition to that, as they were leaving, because they were put up in university hostels, the government was asking for people to pay for the time that they stayed there. And so that was problematic. A second thing was, people not having enough food, or all sorts of complaints that came with their experiences of being quarantined. But in addition to that is this same problem of myths and information flow, which is also affecting how people react. So there have been all sorts of myths to say, COVID-19 was meant, to eliminate some Africans, and you then, where in the midst of all this, you hear the French scientists that said a new cure should be tested in Africa, and so that created.
It's a fascinating question. This whole question of information and what sources of information are trusted. It seems like it matters enormously. I know, Rachel, you think about Europe, in Germany, which has been one of the, maybe the most successful country in Europe in managing this. Part of the success, at least, is attributed to the high level of trust in public officials and the public health system, and the willingness of people to follow and maintain social distancing and other practices. Is that what you see there as you look across Europe, that the level of trust in public institutions is at least one of the factors?
Yeah, there's been analysis done that, in fact, public trust in public institutions has a huge effect now on how repressive governments are with respect to the restrictions, particularly on individual rights. And unfortunately, the further east you go, the less public trust there is in institutions, and the more repressive governments have been with respect to particularly individual rights I think Romania versus Germany versus Denmark is a very good example of that contrast, where, you know, the Romanian public authorities have really cracked down on individual liberties in particular to try to control the spread of the virus. But then there are other cases too, which I think are quite different from the sentiment that Sandy was talking about. I mean, I think Europe has some of the world's best and worst cases in terms of dealing with the virus and trying to preserve democratic governance at the same time. I mean, the EU currently now really, I think we can say, has its first dictatorship in the European Union since the inception of that organization 70 years ago, and it's Hungary. And Viktor Orban, who's the prime minister and runs the political party called Fidesz, came to power most recently in 2010, and they've been in power ever since, and they've been, you know, pretty diligently chipping away at the democratic institutions there. And since the onset of the virus, and particularly since March, Parliament, which was controlled by Orban's party, has essentially handed all authority over to Orban so that he rules by decree. He suspended all elections, and there's no time limit put on his authority, and really no limits on his authority either, because he's undermined the independence of the courts and the media. He's inculcating a certain kind of nationalism also in the public curriculum and in the arts. And so, you know, Hungarian democracy under the pandemic is basically finished. And, you know, the problem furthermore is that the European Union doesn't know what to do about it. And Orban and his friends in Poland of Law and Justice Party know that if they take these kinds of draconian measures in the current context, everybody is so overwhelmed with their own problems at home. These countries know that the EU and Western leaders are not in a strong position to call them on these anti-democratic measures. So, in response to Fritz's original question, there's, you know, some countries there's no balance, right? There's no balance between supposedly managing the pandemic and preserving democracy, because there's no interest among leaders in doing that. And, you know, you can, right, Europe's one case, but there are similar developments in places like Israel and India, where you have—
The next question really is how, in a way, I mean, how widespread is this? I mean, to what extent do we see, let's say, leaders around the world who have authoritarian tendencies at minimum? To what extent are they exploiting this moment to further that ambition, not just to contain the pandemic, but also to consolidate power? And you began on a list there. You know, you would put on that list Israel. You mentioned in passing.
Yeah, I mean, Israel pretty early on shut down its courts. Of course, that conveniently postponed Netanyahu having to appear in court on charges of fraud, bribery. You know, I think some countries, including one that we've held out as basically a positive example, South Korea, you know, very intrusive use of data and personal data to try to track the virus and contact tracing. I think in India, the issue, which of course was an issue also before the pandemic, the fomentation of sectarian violence and antagonisms really promoted by the government, also being enabled by the virus. So there are lots of countries in which this is going on. I'm sure in
Singumbe, if you're seeing this, is the same dynamic in Africa and in certain countries?
Yeah, yes, it's happening. So, I mean, yes, of course, Africa is quite large. So, but there are certain specific cases, like the case of Mali. You know, they went ahead and held elections under very, very, you know, undemocratic circumstances. It's also about to happen in Burundi, even though the cases are going up. The one who was president before, Nkurunziza, he failed to get a third term, and he got somebody in his party who aligns with his interests, and now they're taking this as an opportunity to go ahead with elections under very difficult circumstances. Just yesterday, there were all sorts of violent activities. Just, you know, in Mali, going back to Mali, the voter turnout was 22%. And in most of those that voted followed these patrimonial clientelist lines. And that is likely what is likely to happen in Burundi as well. One more case that's happening is also Malawi. They're going to be voting in July. And given these circumstances, the government took advantage to borrow about $37 million from the World Bank. And, they're handing out these social cash transfers, about $40 to $50 for the next 3 to 4 months, which, it really coincides with the election timing.
We're seeing this, or some people would argue we're seeing some of this in the U.S. as well, and maybe we'll find out more as we move forward towards our election. I wanted to focus on what I see as a particular dynamic here related to the conversation we're having, but it's the politicization of information about COVID, because you see around the world. And inevitably, it's tempting, to be honest, we see it in the U.S. It's tempting for political leaders to attempt to control information so as to either minimize the apparent crisis and thereby presumably avoid criticism, or for nationalistic reasons to say we're doing it better than someone else. And of course, China is fascinating, and I know, Sandy, you followed this really closely. Early on, of course, it hid the problem for at least a period of time. If you believe the data coming out of China, it appears to have solved the problem. I mean, there's nothing. But as you look around the world, and I, like everyone, you probably do the same. I'm always looking at the data, looking to see the trends and which countries are up or down. And you realize, of course, that this isn't just an artifact of the actual extent of the disease, but it's also an artifact of, one, of course, the ability to collect that data, but also it seems to be controlled in some way. So I'm just curious, maybe Sandy, you could start on this, sort of, to what extent can we trust the data that are out there? To what extent is this being manipulated by governments for political reasons?
Oh boy, that's a good one. I think one of the challenges that the global society faces is dealing with uncertainty. And that is what we have here. We have a novel virus. You referenced China, and it's interesting because China definitely took some actions early on. They had information about human-to-human transmission that was suppressed. And I think that that's a legitimate criticism. But there's also a lot of uncertainty about what this was. And we didn't know that this was caused by coronavirus until January 7th. And, China said December 30th, we have some sort of weird pneumonia in the middle of pneumonia season. And so you think about, we have a disease that takes 3 weeks to manifest severe symptoms. So if you look at probably exposure happened in November, one case isn't going to trigger a response from China because we're seeing other pneumonia cases. So it takes a cluster. And if that happened kind of mid-December, 2 weeks later, China's saying, hey, we have a problem, we don't know what it is. A week after that, we're saying it's coronavirus. There was then a scramble to develop testing. And I think one of the challenge is, again, we're dealing with uncertainty. It's not just China. We've seen testing issues around the world very strongly in the US. So it's hard to actually say when there is deliberate manipulation of data, although there are some clear cases where that happened, versus when we're just dealing with uncertainty. And my observation, most national leaders are very poor at communicating uncertainty. I think Angela Merkel did an amazing job. I think Boris Johnson started off communicating uncertainty and then he shut down, and he got challenged on that when he didn't share the models that were being used for decision making. And our numbers and our understanding of how many people are sick are going to change as our technology evolves. It's going to change over time. Our understanding of deaths is changing. And, you know, people are like, well, when you're dead, you're dead. So doesn't that count as shouldn't we have easy access to that data? Well, no, if you look at Wuhan, if you look at China, there were people that were dying in hospitals. That was the first cluster of deaths that we had. After things started to calm down, there was a second inventory of the people that died at home. So that's when we got that big bump in the number of deaths. We're having that same conversation in the US right now. We're likely to see a revision in our death totals because what was captured in our surveillance system is different than what escaped it because of how we were putting people in hospitals and how we were classifying cases.
Oh, oh. Well, it's interesting because you focus on rightly the incredible uncertainty, the complexity of deciding what of multiple causes actually caused that death, all of the issues, and then of course the difficulty of communicating that at some level that's all fairly benign explanation as to why we might not be getting good information. I'm curious whether you or other, maybe Singumbe or Rachel, could point to examples where it does seem like there's actual intentional misleading, either by refusing, one way to do this is not test and then you don't know and then you don't have to report it, or suppression of information. I don't have a feel for that, but in Russia, for example, for a long time, Putin very proudly saying, we don't have a problem here. Now they appear to be reporting, but is there manipulation of the data intentionally for political reasons? Are we seeing that in certain places? So I see Singumbe is nodding.
Yes. So there are two factors that I'm seeing. One factor is if there is an election that is going to be held in the next few months or later in the year, some of the governments are, trying to keep information from people. So the really quintessential case is that of Tanzania, where John Magufuli is really not providing the right and the right number of cases. And because of that, the Zambian government decided to close its border with Tanzania because there was this idea that there was no COVID, and on top of that, Magufuli was claiming that he has already found a cure with the Malagasy president Andre Rajoelina, and that tonic is something that has not been tested, and it might be working because Madagascar has got 0 deaths with 193 cases, confirmed cases, but it has not been tested. And so he has told his population that, that is really the cure. It scores points for him for the election. But also the motivation behind some countries in Africa reporting accurate figures is because there is this $1 million from the IMF that is available. And in order to get that, they need to provide accurate information.
No, helpful. And I don't know, Rachel, if I characterize Russia at all fairly or accurately, or if you're seeing that.
Yeah, I think you're right on Russia. And the other thing that Russia is doing, speaking of democratic decline, is they're using the crisis now. I mean, to a certain extent, I guess reporting larger numbers works in a way to some leaders' benefits, because in Russia, they're now installing surveillance cameras. Clearly not about the virus. I mean, in theory, you can use it to track cases, but they'll use it to keep track of people who are protesting against the regime. I think in this regard, there is a bright spot, at least in West European politics, going back to some of the things that Sandy said. In democratic countries where you already have pretty good information flows, it's pretty hard for nationalist xenophobes to keep up the narrative that this is generated by foreigners, it's generated by minorities. And so in places like Germany and Italy, countries that have these right-wing Eurosceptic nationalist movements like the Alternative for Germany or the League in Italy or the National Front in France, it's become harder, I think, for these anti-integrationist, in some ways anti-democratic movements to keep up their momentum because they're being overwhelmed by the rationality and the expertise-seeking leaders like Angela Merkel, right? And Angela Merkel is a model because of the way she's put together a pool of genuine experts, and to the extent then that democratic leaders rely on accurate data, of course, they build enormous credibility and legitimacy with their publics.
Well, it's super interesting, and all of you listening can see I'm happy to monopolize the conversation. I do want to open up to questions in just a second. So if you have a question, type it into the Q&A box. Just one last question for our panel, and then we will turn to the. We're a School of International Relations, so it's a real international relations kind of question. It's been said that this is the first global crisis in the last century where no one is even looking to the United States for leadership. And so the question is really, so what? What difference does that make, not just in the US's role in the world or status in the world, but for the world? What difference does it make that the US is not playing a leadership role, or the leadership role that it has played now for the better part of a century? Sandy had her hand up, so Sandy.
Well, I suspect from different aspects, we can all say that this is incredibly disappointing. From the global health aspect, this is devastating. And I think something that people don't realize is the US has actually been the largest funder of global health programs worldwide. And it did this through liberal presidencies, it did this through conservative presidencies. And part of what we gained through funding was also dissemination of knowledge and this ideal that we used evidence-based practice. We have so completely stepped back from that. We have, like if we look to, I think, one of the true successes in global health, we have the smallpox eradication. Mm-hmm. And what was amazing was smallpox existed for centuries. We had a vaccine since the early 1800s. And yet this was something that was killing 1 million people a year until 1967. And in 1967, the USSR and the US said, we're actually going to cooperate. And this was a huge political negotiation because teams under the aegis of the WHO, AKA spies for the West, or spies for Russia, were being deployed behind the Iron Curtain. They were being deployed to countries, and there was this fear that they were going to use this to gather intelligence. And instead, they defeated a major killer. And it was leadership really through 2 countries, which actually gave tremendous credibility to other political programs. And again, the US is losing all this credibility at a time when our research institutions are critical to coming up with technological interventions for Corona. But who's going to trust us?
It's a great historical example, and it certainly makes the point. So I don't know if Singumbe or Rachel, you'd like to elaborate or add to that comment.
Yeah, what I'd like to add from the African experience is, COVID-19 arrived much later than Europe and the United States, and so somehow Africa has been able to watch what these different regions have been able to do, and then make decisions based on that. The other point, though, is because China has already been really influential in the African continent, what China has done may be something that Africans have been following as well. Of course, it's not all African countries, but you see that kind of draconian, approach also being used in a number of African countries. You can also say that, Africa is also using its own experience based on, handling Ebola and tuberculosis, malaria, HIV, and AIDS, and cholera. All those have provided certain lessons.
That's great. Let me Rachel, I'm sure you would have a great comment on this one, but let me turn to the questions, because I'm realizing we have a great slew of questions here from the audience, and I want to get as many of those in as we can. So we'll try to do that. A first question from our colleague, George DiMartino, who writes, I've been surprised by the level and intensity of the opposition to the public health measures taken in the US to reduce transmission. Should we be surprised? Or is opposition to quarantine isolation a typical feature of pandemics? Was it a feature of the SARS, Ebola, and other previous pandemics, including 1918? Or is this a unique feature of this crisis?
I will take that. I guess I'll take that one. Hi, George. It's not a unique feature. There was resistance to, in 1918, in the pandemic, in the US, we had different pockets of resistance to measures that were taken by both the federal government and the state and local government. So that's certainly not unique to what we're seeing right now. And I think that that's kind of the beauty of a liberal democracy, is people question what's happening, although they perhaps not as violently as we're seeing right now. With SARS, in the US, we didn't have isolation or quarantine. The US wasn't really impacted by SARS. Canada was. Canada did issue small-scale isolation and quarantine, and that seemed to go fairly peacefully. It was used on a broader scale in Korea. It was used on a broader scale actually in Singapore, which has been very careful with isolation and quarantine this time around. Neither of those seem to have, I would say South Korea initially had some questions, but it was because they hadn't had an experience with a pandemic before. Then we had, then South Korea had kind of the H1N1 2009 pandemic, and then they also had a MERS outbreak. And so now people are kind of like, okay, this happens, it helps stop the spread. I think I'd be really curious, because Singumbe mentioned a number of infectious disease outbreaks in African countries. If those with experience with these infections are actually more, complacent's not quite the word, but they're more accepting of some of the measures because they've seen the benefits of the measures.
I think so. A lot of the measures that have gone with COVID-19, some of them have been implemented already. Things like washing hands. So there's already that culture of washing hands and trying to be in well-ventilated areas. What is really new about this in the African context is this social distancing. And that is where, particularly with people being, under lockdown, that is really new. And that's where, but then the reaction, of course, in terms of protest is really not that new. But that is the main thing that is new.
Yeah, I wonder in the U.S. context, we're so polarized. What you're seeing is a kind of partisan response in the protests, and so even the act of wearing a mask becomes a symbol of your political identity. And so we're in a very particular context in the U.S., which seems to be manifesting itself in the. Have we been partisan before? Yes. Have we had people believe things that weren't true before? Yes. But it is interesting to think about the particular context it seems to me, in the U.S. A related question here from Doug Scribner. He says, both Sandy and Rachel spoke about trust. Is it even possible? Oops, it's now disappeared from my screen there. So, but I think the question is it possible for leaders to build trust in this kind of context? And really, ultimately, it's about the importance of trust. Rachel, you gave us a kind of tour of the horizon over countries. I wonder whether if you thought of trust as a sort of explanatory variable, how important is trust in predicting how effective a country is going to be in responding to this?
I think it's very important. And yeah, I think in answer to Doug's question, it's an incredible opportunity for leaders, some of which are clearly squandering it, to build trust with their publics through their response and through their attention to expertise and their heeding of expert advice and health advisors' advice. So yeah, I think it's absolutely important. And as I mentioned before, you really do see a gradient across Europe in particular in the stringency of the measures required by governments and levels of public trust. Where public trust is high, governments can be more lenient and protect democratic quality more effectively where public trust is high. I think going back just to a second to George's question, which also relates to Doug's question, the structure of the economy has a huge effect on how well we can preserve democratic quality in the crisis as well. I think part of what's going on in the United States, I think Fritz is right, there's a partisan response, but the catastrophic effect in the US of over 30 million people unemployed, 27 million people newly uninsured. This is not happening in other advanced industrialized countries because they have better ways of dealing with an economy in crisis, particularly in Europe, governments funding employers in order to keep people in work, and also the idea in many advanced industrialized countries around the world that you have universal healthcare, which we do not have, right? I think this fuels not only mistrust in the population because the economic calamity is so severe, but it also potentially fuels protest against restrictions on personal rights because the economic situation is so dire.
Very interesting. Let me take another question, and we've not too much time left. But here's a question from Holden Fitzgerald. What do you expect the impact will be on protest movements that were taking place prior to the COVID outbreak in places like Hong Kong, Chile, Iran, Lebanon, etc.? Thoughts? Maybe, I don't know. Rachel, do you want to start on that one?
Yeah, I mean, the problem, right, this is a critical area for democratic governance. It's related to accountability, to individual rights, to the extent to which the media can do its job. In the countries that the questioner asked about, protests have been shut down. In a country like Chile, the military presence has increased. It's a fundamental part of how the government perceives an effective method of enforcing social distancing. And so it's highly problematic. I know that protesters are trying to find virtual ways of registering their protest movements, their unhappiness, their mistrust, but it's not going to have the same effect as a critical percentage of the population being out in the streets and really holding governments accountable. So this is one of the areas, I think, in which, yeah, there should be deep concern about democratic processes and the use by governments of military forces to restrict people's rights.
Great. Let's take another one here. So Abdullah Sharafi, the COVID-19 shock and subsequent lockdowns and curfews triggered supply and demand shocks. Significant monetary and fiscal steps have been taken to prevent economies from experiencing depression, but how feasible are the steps that have been taken? Maybe Singumbe is, could weigh in on that. Oh, you're muted again.
Thanks.
Here he is.
These measures are really temporary measures that have been taken, and a lot of what it's almost like a wait and see situation. So if the pandemic continues, next fall, if we have a resurgence, then we have a longer term economic issue to deal with, and that's really going into a depression. And so even the IMF and World Bank predictions, they are all the best case scenario is that by the end, in this next quarter that we're going to enter in, that the pandemic starts to go away and the economy begins to open. But if it does not happen, then longer term, what we have is a bigger issue, really worst case scenarios. And so, yeah.
Yeah, and I think, what's interesting about, you think about the economy, there's the sort of the aggregate growth question. But as we all know, the question of inequality is such an important one on the global scene now. And as you were talking earlier, Singumbe, and we've been talking about the differential impact on marginalized communities that have, or in countries that have less of a social safety net, et cetera, seems to me to be a big issue, even if we stabilize in aggregate. The question. We'll try to get a couple more in here. Nushka Bose thanks us for a great discussion. Thank you. Places like Israel, South Korea, Taiwan, Hong Kong have employed surveillance technology to combat the spread of virus, and they've been successful in many ways. Why do you think democracies like South Korea have been more successful in implementing surveillance technology? In Western democracies, these measures would likely be seen as an invasion of privacy. Sandy.
I think that's such a good question. And part of it, one gets a sense that there are cultural differences. It's been argued that there is much more a sense of investment in community and caring for the community as opposed to caring for individual rights. In a number of Asian nations, this has come up multiple times in Singapore. It's come up with South Korea. I think, again, there's also the fact that these countries have experiences more recently with pandemics, and they've seen what happens when the government doesn't take action as opposed to when it does. And that because of that familiarity with more recent pandemics, there may be this more willingness to kind of relinquish certain rights. I have not been to South Korea, but I am told by several people that have been to South Korea, everyone's life is online. And so the digital, the digital world is also a little bit different than what we experience in the US. To me, I think it's a little ironic when we think about some of the legislation that came up over the last 2 years trying to regulate how our digital privacy was being used or exploited by commercial interests. And we don't have restrictions on that, but we're having this conversation about protecting individual rights in terms of using data to combat a pandemic. That's kind of this interesting thing to me, and what we ignore and say, oh, that's part of the digital world, and what we're very protective of.
Very interesting. Well, we are seconds from the witching hour. I'm afraid there's a stack of other questions here. There are a couple here though. Let's try to get this one more in on China. So one question, Peter Gilbertson, is discuss how China is managing global messaging and propaganda in the void created by the absence of U.S. leadership. And another question from Susanna Park, who says she thinks there's a tendency among Western democracies to place importance on maintaining democracy while demonizing other countries, and she cites the continued focus on China's response. So we put those two together. I guess the question maybe is ultimately one of to what extent is China being successful in some ways in messaging its response to COVID in ways that, to put it crudely, that sort of is propaganda for the so-called China model relative to democracy, if we think of it in those terms. The premises of these two questions is different. I'm going to just for the sake of time, I'm going to throw that one at Rachel.
So I would say, I would also demonize my own country, which is the United States. I mean, if I compare the US and the Chinese response, both countries have abysmal dimensions to their response. And I think in China, since that's what the question was about, the initial cover-up and the shooting the messenger, so to speak, is a terrible feature of the Chinese system. And we talked earlier about the Chinese control measures on the spread of the virus, which might be good, but I feel like I don't know, because I sense that the regime is so dishonest with respect to the statistics that it reports. And, it is a country also that tells us that the million or so Uyghurs that it's detained are undergoing voluntary re-education, right? So with respect to messaging in the crisis, I think China, not unlike the United States, the United States also has a credibility problem with respect to information under the current administration, but China has a very serious credibility problem in its messaging, and I think it continues into this crisis.
I think that's right. Well, as you can all hear, we could go on all day with this, but we are out of time. So let me thank first all of you for being with us today, and thanks very much to my colleagues and our panel today. I hope you enjoyed the conversation, and please be well.